Colby Quintenz. I have been practicing at Grand River Health for about a year and a half now, but I actually started back in Ohio. I was born at Ohio State University Hospital and I never left. I went to college there and I went to medical school there, so I was a student there for about 8 years. I was drawn to rural pediatrics initially because I wanted to live in a rural area, but since I started practicing in a rural area, I found that it's actually a lot different than practicing in a large city. For one thing, you are responsible for a lot more in a rural area. In a large city, you have every specialist at your fingertips, and I think you tend to be more of a clearinghouse and send your patients off to other physicians if they have really any kind of problem. In a rural area, you tend to work things up a little bit more yourself, which is really fun. You get to use your training a lot. I really had heard great things about Grand River Health from some other physicians who worked here, and when I came to interview at the facility, I found everyone to be really warm, and people seemed to have a shared goal of really doing the best thing for the patients, and I thought that it would be a great place to practice and to take care of children and their families. I love children, and that naturally drew me to pediatrics when I was thinking about a specialty, but the actual moment that I decided that I was going to be a pediatrician, I was doing a pediatric rotation in medical school, and I had a little boy who'd been in the hospital for several days, and he had just not felt well at all. Every time we went in to see him, he was cranky and would cry, and I went into his room one morning. We do our rounds very early, and it was about 6 o'clock in the morning, and he was bouncing on the bed and he had cookies all over his face. And that was how I knew both that he was ready to go home from the hospital and that I wanted to be a pediatrician, because you don't have experiences like that in any other field. The kids are really fun. I think it's really important for a child to be seen regularly by a pediatrician or a family doctor because there are so many things that change during childhood, and a lot of parents don't have a ton of experience with kids and they don't know what's normal and what's not normal. The vast majority of kids are normal, and medically they would probably be fine without a ton of medical care. But there are also things that parents are doing in their interactions with their kids that shape them for the rest of their lives, and I think it's really valuable to have a relationship with someone who can talk to you about what are you doing that's shaping your child's development. How are you teaching them to be a responsible person? How are you teaching them to be safe? How are you teaching them, what's healthy and what's not healthy? And I think it's really great to have somebody to help guide you through that. Anytime a family moves to the area or is getting ready to have a new baby and wants to check out the pediatric services at Grand River, we offer a meet and greet appointment. This is a time for the parents, or if there are any children already in the home, to come in a non-medical situation and just meet with the pediatrician. They get a feel for our personalities, they get to ask us any questions they have about the practice, they get to take a peek around, and I just think it's a really good way for them to decide if this would be a good fit for them for pediatricians.